Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Perineorrhaphy. Introduction. Perineorrhaphy, also known as perineoplasty, is surgery to repair damage to the perineum. The perineum is the area between the vaginal opening and the anus. Your healthcare provider may recommend perineorrhaphy if you have excess skin or other problems with the perineum. If your healthcare provider recommends perineorrhaphy, the decision whether or not to have the surgery is yours. This program explains perineorrhaphy. It covers reasons for perineorrhaphy and alternative treatments. It also explains what to expect before, during, and after a perineorrhaphy. The female genitals. The vulva is the external female sex organs. It includes the vaginal lips, clitoris, and the openings to the vagina and urethra. Behind the vaginal opening is the anus. The anus is the opening of the rectum to the outside of the body. The area that connects the openings of the vagina and anus is called the perineum. Reasons for perineorrhaphy. There are many reasons a perineorrhaphy may be done. Perineorrhaphy repairs damaged tissue of the perineum. The perineum may be damaged from childbirth. In some women, tissues in this area may tear during delivery. Sometimes an episiotomy may be done during childbirth to prevent tearing. An episiotomy is a surgical cut in the perineum, but in some cases an episiotomy may not heal correctly. It may cause problems. Weight gain may stretch the perineum and cause excess skin. It may also lead to muscle separation that causes weakness. Some women have a loose, sagging feeling in the vaginal area. Perineum damage may also cause lessened sexual sensation or satisfaction. Damage to the perineum can occasionally happen along with other problems, such as anal problems. Rectocele, which is when the rectum falls to the front and pushes against the back wall of the vagina. The perineum may also bulge or develop skin tags. Sometimes damage to the perineum has no known cause.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Alternative treatments. Other treatments for perineal damage depend on the extent of the damage and your symptoms. Some women may choose not to be treated if they do not have any bothersome symptoms. You can also take steps to prevent further damage to the perineum. Straining during bowel movements can damage the perineum and surrounding tissues. Drink plenty of water. Avoid constipation by eating fiber-rich foods such as fresh fruits and vegetables. Kegel exercises may also help. These exercises strengthen and tone pelvic muscles. They are similar to the movements you make if you are trying to stop urinating. Over-the-counter pain medicines may help with pain in the perineum. Your healthcare provider may recommend surgery if other treatments do not work. He or she may also suggest surgery if you are bothered by excess skin or other problems with the perineum. Before the procedure. Your healthcare provider may ask you to stop taking some medicines. You may need to stop some medicines for up to 1 week before the procedure. Arrange for a ride home from the hospital. You will not be able to drive right away. Do not eat or drink for at least 6 to 8 hours before the procedure. It is best to have a perineorrhaphy while you do not have your period. Perineorrhaphy. A perineorrhaphy is done under general anesthesia. You will be asleep and will not remember the procedure. The surgeon makes an incision at the vaginal opening. Sometimes the incision is made in the back wall of the vagina in either a V or U shape. Any existing scar tissue, excess skin, or other abnormal tissues are removed. Damaged muscles may also be repaired. The tissues are then brought back together and stitched in place. The stitches may be dissolvable. If this is the case, they will last for up to 4 or 6 weeks. If the stitches are not dissolvable, they will be removed by your surgeon. In total, the surgery takes about an hour. The surgery may take longer depending on the extent of the damage being repaired. Risks and complications. Perineorrhaphy is safe, but there are still some risks. Complications can happen. Knowing about them can help you detect them early if they happen. The risks of perineorrhaphy include those related to anesthesia and those related to surgery in general. Anesthesia is safe, but like any medicine, it can have risks. Complications of general anesthesia may include chipped teeth, cut lips, headache, sore throat, urinary retention. Rarely, anesthesia may cause serious complications. These include lung infections, stroke, heart attack, death. Your anesthesiologist will talk to you before surgery. He or she will ask you about any medicines you are currently taking. He or she will explain the risks and complications of anesthesia. Blood clots in the legs can happen due to inactivity after the surgery. These usually show up a few days after surgery. They cause the leg to swell and hurt. Blood clots can become dislodged from the leg and go to the lungs. There, they will cause shortness of breath, chest pain, and possibly death. Let your healthcare provider know right away if you experience symptoms of a blood clot. Sometimes the shortness of breath can happen without warning. Getting out of bed shortly after surgery may help decrease the risk of this complication. Surgery in general also comes with risks. Complications may include bleeding that happens during or after surgery. Bleeding may rarely require a blood transfusion. Infection, either deep or at the skin level. Skin scars that may be painful or unsightly. Risks and complications might also be related to this specific type of surgery. Possible complications of perineorrhaphy can include failure to correct symptoms, pain during sex, after the procedure. You can often go home the same day as the surgery. You may need to stay overnight in the healthcare facility if you experience any complications. You will need to rest regularly for about 2 weeks. Do not exercise or lift heavy objects during this time. Sexual activity must be avoided for at least 4 to 6 weeks after surgery. Ask your healthcare provider when it will be safe for you to have sex again. Wear sanitary pads after the surgery to absorb blood. Some bleeding after surgery is normal. You can also use ice packs to relieve pain and swelling after surgery. Ask your healthcare provider about when you can return to work, shower, bathe, or soak in water. Start driving again. Drink plenty of fluids and eat enough fiber to prevent constipation. You can also take an over-the-counter stool softener. Call your healthcare provider right away if you experience burning while urinating, difficulty urinating or passing stools, fever. Also contact your healthcare provider right away if you experience increased or severe pain, increased vaginal bleeding or passing blood clots, vaginal discharge with an odor.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Perineorrhaphy, also known as perineoplasty, is surgery to repair damage to the perineum. The perineum is the area between the vaginal opening and the anus. Your healthcare provider may recommend perineorrhaphy if you have excess skin or other problems with the perineum. Problems with the perineum may be caused by childbirth or weight gain. Sometimes the cause is unknown. Other treatments for perineal damage depend on the extent of the damage and your symptoms. Some women may choose not to be treated if they do not have any bothersome symptoms. Surgery may be the best treatment in some cases. Call your healthcare provider right away if you experience burning while urinating, difficulty urinating or passing stools, fever. Call your healthcare provider right away if you experience increased or severe pain, increased vaginal bleeding or passing blood clots, vaginal discharge with an odor. Possible complications of perineorrhaphy are failure to correct symptoms, pain during sex, infection, and bleeding. Perineorrhaphy is safe, but there are still some risks. Complications can happen. Knowing about them can help you detect them early if they happen.
Thank you for using Explain.